Morning, folks. My name is Robert Manke, M-A-N-K-E, and I'm a medical marijuana user here in the state of Iowa. Board of Pharmacy members. Board of Pharmacy members, I'm here because I need your help. I don't represent anybody professionally. I represent myself. I've been in 3 severe traffic accidents. You want to see what a miracle looks like? This is what a miracle looks like. See me hold my arms up? It's incredible. I'm not in a wheelchair. I have a broken spine. I have 2 Harrington rods, 6 fused joints in my back. I have 4 bone discs in my cervical spine and 2 jellied locations in my brain, as evidenced by CT scans. I know what pain is like. That doctor came up and talked about fentanyl physics. Yeah, I know what they're like too. I take morphine. I take Percocets. I take, what else? I'm on methadones right now. I have severe nausea, folks. I know what it's like to crawl around on the bathroom floor like an animal in the morning, vomiting with my head in the stool, and I need your help. I'm not here because I want to get high. I'm here because I want to stop being sick, and I want to stop being persecuted, and I need your help. This isn't fun to get up here. This is scary. I'm trembling right now. Our laws need to be changed. They need to respect the truth. We need your scientific evaluation, but we also need you to hear people like me very badly. Yes. You need to hear that I'm an Iowan. I was born here in Iowa. My wife was born here in Iowa. All our kids are born here in Iowa. All our parents, mom and dad, parents, born here in Iowa. My grandparents were in the first federal census of the state of Iowa. I'm what Iowa looks like, folks. And I need this law changed. I need this terrorism to stop. In 2007, I was arrested for growing 3 Mexican pot plants in my closet. I didn't do that because I want to be a rebel. I do that because I want to stop puking. I find from my own personal experience something you need to hear. In the morning, I can't take a Compazine suppository. Oh yeah, I'm on that too. I'm also on phenergan. I can't take suppositories because I have a hypercholesterolemia condition. My blood cholesterol is over 900. I take the biggest dose of Tricor you can cram in a human body, and it produces tremendous constipation. I can't get a suppository in there, folks. Just to be blunt, we're talking medical stuff here. But what I can get in me, on the for real, is marijuana. I can smoke cannabis, and I'm telling you, if I have good cannabis, strong cannabis, and I smoke about 2 pokes of that, my nausea is reduced by 50% in like 5 seconds. What do you want me to do? Take injections? I don't want shots. I don't want to be a junkie. I want to talk about my migraines for just a moment. My migraines just utterly crush me. Breakthrough pain? I can write you a book on breakthrough pain. I can. That's why I get the fizzies. And they do exactly like that doctor, that first speaker said. They don't kick in for about 20 minutes. You know what 20 minutes of a really bad migraine's like? I doubt it. And I'm telling you right now, I'm a very serious Christian, and it's about hell on earth. You get so sick and have blinding flashes and vomit and just wallow on the floor and wish you were dead. And it only helps the littlest tiny bit that I'm not at fault in those traffic accidents, folks. It only helps the smallest amount. I need something that works. I need some serious consideration by this board on campus. I'm not looking to get high on dope. If I want to get high on dope, I do just exactly like I tell Senator Grassley. I just reach over to the table side and grab a bottle of morphine, which I hate, by the way. You want to go to sleep for about 3 days, wake up for about 2 hours a day, go get your morphine. I hate that stuff. What the doctor told you about these delays and, for the onset of the medication to kick in, marijuana, smoked marijuana, has a delay of seconds. I have never in my life, I've been smoking cannabis off and on since 1972. At first it was recreational, but since these traffic accidents, I promise you, it's very different. I have never seen pink elephants. I do not hallucinate ever. I've never seen anybody else do it either. I have no sensations of desire to harm myself or anybody else. In fact, I've seen people who would smoke cannabis that were violent out on the construction sites, on professional construction worker, among other things. And it calmed down those violent urges in those people, and they would go back to work, and they'd be straightened out a bunch. This stuff is not what you have had it misrepresented to you to be like. It is not an addictive drug. And I've heard statements about 10% or something. No, it's not. 0. Marijuana doesn't addict people. It doesn't do it. I can't read that thing. Okay.
Yeah,
Okay. Let's see if I gotta take these off just a moment. I want to affirm that stronger cannabis lets me have fewer coughs and better control of my nausea. I affirm that there is no withdrawal from cannabis ever. For me, it doesn't exist. But try and tell me that with morphine or Percocet or, God help me, fentanyl, which is many, many times as addictive and powerful as morphine. Smoke pot helps me stay off of narcotics. I want to talk about severe constipation just a bit again. These narcotic drugs that I take cause severe constipation. Pot doesn't do that. It enables me to take a lot fewer narcotic drugs. But I can't take it because I'm going to get arrested. I'm not interested in hurting anybody. I need some help. Right now, the FDA-approved drugs that I take are prochlorperazine maleate, composite, and phenergan. And I'm telling you right now, not only do they have quite a long delay before they kick in, they don't work as well as cannabis. Cannabis is a more effective drug. I want to talk about pain control for severe migraine. It works. It's real. I've sent a lot of letters to Senator Grassley. Talk about frustrating effort. That guy doesn't exactly like people like me. Who's going to represent me, pharmacy members? If it isn't you, who's going to represent me? Because I need your help. I'm not up here to get high. I'm up here to help you understand that there really are people like me out here. We're islands. And marijuana helps us. I don't like to call it marijuana, it's cannabis. I've done a lot of reading on the pharmaceutical derivatives of this, the sesame oil with the THC. And I personally believe that they're probably right when they say, as that doctor did, that what's in the plant is far more complex, contains far more different kinds of pharmaceutically active molecules than what these stripped-down versions that are being sold to the public provide. There's a lot we don't understand yet. I believe that. But at the same time, cannabis has been so studied over and over and over. I want to present you with one statistic too. 100 people a year die from potato overdose because potatoes have oxalic acid in them and can kill you. There are multiple offers of rewards for thousands and thousands of dollars for one authentic case of cannabis overdose death. And to date, they are unclaimed, and I don't think they ever will be claimed. How can they? Cannabis doesn't kill anybody. It doesn't do it. You don't see pink elephants off of it. It doesn't kill anybody. What do you want? What does it take to get something legal to help somebody like me? I'm tired of being reduced by people like Senator Grassley to being an anecdote. I am an Iowan. I am not an anecdote. Thank you for your time.